I'm joined by Joanne Porter from the Collaborative Evaluation and Research Centre at Federation University in Victoria, Australia, to talk about her new article in Rural and Remote Health, titled Remote Health Solutions in Far East Gippsland, a mixed methods co-designed evaluation of health service availability in isolated communities. Welcome, Jo.
Oh, thank you for having me.
Oh, it's great to have you. Thank you. Congratulations on your great article.
Oh, look, a really important one, and thank you for giving me an opportunity to highlight it. This research project constituted very much a co-design element to it. We worked in partnership with Far East Gippsland communities, members, and the project manager that was up there as well, who was a part of the authorship of the paper and also part of our data collection. So the research team was myself as lead, and then we had two research fellows, Dr. Megan Simic and Valerie Prokovic. And we had a nursing academic, Naomi Cruz, and then the project manager, which from Warm Corners Consulting, who's Eleni McElroy. So the study came about, and really it came about because of two big major incidences that occurred. So you had the November sort of 2019 to 2020 bushfires, the Black Summer bushfires, which were devastating up in that region. And then on top of that, you've had this other really global event, which was the pandemic, COVID-19. And that it just sort of masked all the impact of those devastating bushfires. And so you've got a community that really didn't ever recover from the first incident and then have gone into isolation because of COVID. And that really impacted the Arundra to Snowy sub-district in Far East Gippsland. So what we did was we worked in partnership with community to co-design a way in which to tell the story of this community who have been massively impacted. And as you can imagine, with bushfires come a change of dynamics, a displacement of families. Often families then decide that they're going to move out of these regions because they've had this horrible experience through the bushfires. And every family unit that moves out of that region then often changes the dynamics of the towns. So for example, then you don't have enough kids in the schools to run the primary schools. You then don't have enough, just numbers of people in that community to then justify health services going up there. So this community, they were impacted by the bushfires, COVID, and then realised that they were having services cut and that their connection to the rest of the world was diminishing. So this is, I must admit, one of the most dynamic and forward-thinking community groups that actually put themselves out there and said, we deserve better, and we're going to let the rest of the country know what's happening in our region. So we were commissioned and worked in partnership with them to do a mixed methods approach, which included a community survey and then some rich in-depth interviews with 11 participants. We're talking about an area that has a population of around 350 people. We were able to survey 55 of them, the adults in the region, and some of the findings were really quite telling in the way in which they lived. So, for example, 81% of the participants reported that they delayed seeking medical assistance, which means that they're not getting out to anywhere to seek help. And so they're letting their conditions and their symptoms get even worse before seeking medical help. And they often said that was related to wait times to see a GP of longer than 3 weeks. And of course, the distance, so access for healthcare, there's nothing up in those regions, and so they have to travel. So having to come off their farms and their businesses to then travel to healthcare is a real issue. We talked a little bit about telehealth and opportunities for telehealth appointments, but 77% of those participants said they've never used the service. So it's available, but and we would say that's a great solution for Far East Gippsland. But there are two major things there. One is you've got an ageing population, and the second one is they've got no internet connection. So the connectivity up there is really poor. So even as a solution, we have to put further infrastructure into those regions so that they can access that sort of technology. And they talked about sort of health services that are needed. They need access to GPs, pharmacists, nurses, and dentists in particular. And really importantly, 95% of all the participants we spoke to stated that having a health professional available in person was really important. To have that connection with a human being, with a health professional, so that they could get continuity of care for themselves. So it's not just a spot one-off visit or telehealth to a specialist, that they have somebody that understands them, their family dynamics, how they're living, and all their health conditions. So a holistic approach to their health care. And when it came to some of the interviews, we unpacked a lot of those issues. And one of the big ones is around that these people often live quite close to the border between Victoria and New South Wales. And so there's cross-border issues between Ambulance Victoria, Ambulance New South Wales, and with people really having to decide which way do I go. I live in Victoria, but I'm closer to some health services in New South Wales, but then not being able to get access to those New South Wales, so across the border. And so they talked about just dropping those border issues and reducing those issues would be really important. They did talk about some of the things that work well, and the Royal Flying Doctor Service does go up into that region twice a year and offers a dental service, which is really important. And sometimes they do all community involved days where they've got different health practitioners come up, and it might be a health assessment and a review and a dentist and all sorts of different specialists come up on those days, and it becomes this community festival. But are really important that those things that are working well are continued. So some of the things that are really important for this community moving on is around that we really need to support them to lobby to get better connectivity, so better internet connection, so that they can access some of these more technology-related services to provide them with better healthcare, and to make sure that they've always got somebody in person that is designated to that region that can come and be their health professional, whether it's a bush nurse or a visiting GP that comes up each time. We need to be able to make sure that they've got access to telehealth to specialists, so that they're not having to then spend hours and hours to go to metropolitan areas, either Canberra, Sydney or Melbourne, and they've got access to those specialty services as well. Remove that cross-border barriers, and more importantly, and this is the thing that we learnt the most, is that this community needs to be involved in all decision making, and that they need to help inform policy. So the policymakers sitting in metropolitan Melbourne need to consult with community, because it often looks like just on numbers alone that they don't warrant that kind of services. But if they talk to the community, then they know that what's happening up that end. And so really important that the community is a part of that decision making. And I thought I'd finish with a really important quote, because it really sort of summarises everything about this project. And one participant said, "It doesn't matter where you live in Australia, you have as much right to services as anybody else, whether it's health or education or police or whatever they are. And to keep on saying your statistics or on the numbers of people in a community don't warrant that service is untrue, because a person's a person no matter where they live." And I think that really sums up how this community is taking action to try and tell policymakers that they're an important part of an infrastructure of Gippsland region, and that they deserve the services up in that region as well.